All right, everybody, Dr. Rafich here from Vet Triage. We are continuing on JAVMA, October 15, 2016, and we are talking about rigid urethrocystoscopy via a percutaneous fluoroscopic-assisted perineal approach in male dogs. 19 cases. This comes out of the Animal Medical Center. One of the researchers here, Chick Weisse, is a vet that I've known for a long time. Well, peripherally known. He's quite well known in the literature space and in the surgery world and what have you. So we'll go through this paper. The objective, Animal Medical Center is in New York City. The objective is to describe the technique and outcome for male dogs undergoing rigid urethrocystoscopy via a novel percutaneous fluoroscopic-assisted perineal approach. So, just to give you an idea, they're using a rigid scope. So this is a rigid scope, meaning it's not flexible. It can't move. And this is just a drawing of a female dog on her back, and they're inserting the scope through the vulva, through the urethra, and then into the urinary bladder. And so that's the mechanism, the procedure for that. So in males, the problem is because of the shape of the urethra, you can't do this through the urethral orifice in the penis, because the penis and the urethra are obviously going to be bent, and these are rigid scopes. So they're trying to figure out a way they can make an incision here for the male dogs and then enter the urethra that way instead of going through a penis to enter the urethra. So retrospective series, 19 dogs, all male, obviously. Results show that 19 male dogs were successfully underwent 20 procedures. One dog had 2 procedures. No intraoperative complications. Short-term outcome was good for 3 of the dogs, which is because they had mild perineal urinary leakage. And then no problems in the other 16, so excellent outcome for them. Long-term outcome was excellent for 17 dogs. Conclusions and clinical relevance. A percutaneous fluoroscopic-assisted perineal approach with or without ultrasonography allows access to the pelvic urethra with no major complications in the present series of patients. Introduction. Endourology, the diagnosis and treatment of urogenital tract disease by means of fluoroscopy, ultrasound, various flexible and rigid endoscopes, assorted retrieval and biopsy devices, intracorporeal lithotripters, and lasers, guide wires, catheters, and stents, has been a rapidly growing field in the management of small animal patients over the past decade. Conditions treated include benign and malignant urethral and ureteral obstructions, ectopic ureter, idiopathic renal hematuria, and urolithiasis. The flexible scopes are limited in imaging and procedural capabilities because of the fiber optic technology, diminished illumination, difficult angle deflection, and small working channel. In contrast, the rigid scopes provide well-illuminated and highly detailed images with rod lens system technology. The angled lens of the rigid scopes also provides an expansive field of view, and the rigidity facilitates examination of structures throughout the lower urinary tract. Better suction and better irrigation, and it accommodates a variety of instrumentation as well. Retrograde rigid urethrocystoscopy has been typically limited to female dogs because of the narrow, long, and curved male urethra. The use of flexible scopes, typically human ureteroscopes, has largely replaced the use of rigid scopes in male dogs. We have the publishers of this paper, or the authors rather, have described previously a novel, minimally invasive fluoroscopic-assisted perineal approach for a rigid urethrocystoscopy in male dogs. Materials and methods. This is a picture here of how the dogs are positioned on their back with the legs pulled forward. And then here is the various stages of doing this. We're not going to go through it because it's a lot of it's very technical, and it'll just end up boring you really. But they'll use a combination of ultrasound and fluoroscopy to pass a catheter in the urethra, make a perineal incision, and then access the urethra through the perineum with their scope. And so this entire process is based on distending the urethra with contrast solution using guide wires. They describe it very well in the paper. We're going to bypass all of that. And then here is an example of them actually doing it. So you can see with A and B, they have the fluoroscopy machine in A, and then for B, they're passing the scope through. C shows the incision that's performed in the perineal region, and then D shows the same dog 3 months later with the healed incision. They let the incision heal by second intention. So we're going to go right over to results. 15 of the dogs were neutered males. The rest were intact males. Conditions include ureteral ectopia, obstructive uretoliths, idiopathic renal hematuria, septic ureterocele, and intravesicular mucosal hemorrhage. Median age was 4.6 years. Median weight was 27 kilograms. Most of them were Labrador retrievers. Some had concurrent issues that were either related or not related to the urinary tract. Regarding the procedure, rigid urethrocystoscopy was performed successfully in all 19 dogs. The procedure time was about 11 minutes. The median number of attempts was 2. Once access with the rigid scope was established, endourologic procedures include bilateral and unilateral cystoscopic guided laser ablation of ectopic ureters, bilateral and unilateral endoscopic guided renal sclerotherapy for idiopathic renal hematuria, bilateral and unilateral ureteral stent placement, septic ureterocele ablation, and laser cauterization of intravesicular mucosal hemorrhage. So don't forget, the whole point of this entire procedure is to get better imaging and access to the male urethra and bladder and beyond. And so this paper is based on accessing it, but then these other procedures, these dogs actually needed the procedures done because they had disease or whatever. So the 11 minutes procedure time was just to get access to the area of interest, and then from there they had to do the actual treatment. 3 of the 19 dogs had urinary catheters placed postoperatively. They were kept in for a mean of 12 hours. 11 of 19 dogs were managed as outpatients. 8 of 19 dogs hospitalized overnight and discharged the next day. 1 dog was hospitalized for 2 days. And as for folks who watch this channel, you know that I wish they had percentages because giving us absolute numbers like that don't mean too much. Follow-up and outcome. Median follow-up was 268 days. In the short term, 16 of the 19 dogs had excellent outcome. 3 had good outcome. The 3 with good outcomes had minor urinary leakage from the perineal site during voluntary urination up to 2 days after their procedure. Discussion. Whereas flexible scoping has been extensively used in male dogs because of their urethral anatomy, it can limit visualization, procedural dexterity, biopsy acquisition, and the ability to access the ureterovesicular junction. Therefore, male dogs undergoing endourologic procedures such as ureteral stent placement, scope-guided laser ablation, renal sclerotherapy, and urinary bladder biopsy may benefit from the use of a rigid scope. Previous reports have described perineal approaches for rigid cystoscopy in male dogs. We suggest that it may be, we being the authors, suggest that it may be the perceived potential need for subsequent surgery and the attendant risks of hemorrhage, urinary leakage, and urethral structure that have encouraged clinicians to use flexible scopes. The fluoroscopic and ultrasonographic-assisted perineal approach to the urethra described in this paper is a minimally invasive approach that does not require surgical approach, dissection, or incision into the urethra. None of the dogs in this study were suspected to develop urethral strictures. Only 4 of 19 dogs, however, underwent repeated diagnostic imaging. It is possible that strictures occurred in some of these dogs but remain undiagnosed. Another study reported that urethral narrowing may need to exceed 60% of urethral diameter to have clinical signs. As such, any dogs with less than 60% could have developed but without clinical signs. And these dogs did not undergo repeated evaluation. So yeah, I love papers like this that try a new procedure and go for it. Obviously, they of course mention the limitations of retrospective studies and inconsistency with the medical records as far as follow-up goes. But that's how it goes with these things. But otherwise, I really enjoy novel techniques like this. So very cool. All right, we'll see you guys tomorrow. Thanks.